The United Nations Food and Agriculture Organization in Southern Africa has launched a One Health regional project that aims to sustainably balance and optimize the health of people, animals and ecosystems, especially in view of the recent COVID-19 pandemic. The FAO has launched a series of regional projects, as we mentioned, that will be implemented in Southern Africa, mostly in partnership with SADC, the Secretariat and other development partners. To speak a little bit more about this project now and what it's envisaged to achieve at a regional level, we're joined by the FAO Sub-Regional Coordinator for Southern Africa, Dr. Patrice Talla. A very good evening to you and thank you so much for speaking to us.
Good evening.
Perhaps
and thank you for the invitation. Yeah.
It's a pleasure. Let's just start with the mandate that is enjoyed by the FAO in Southern Africa and how these projects are going to help strengthen it.
So thank you very much. First, on our mandate, what I would say is that our mandate is articulated around the vision of the organization, which is really to improve the life standing of all, especially the poorest, in an economically, socially, and sustainable manner. So our vision is also reflected in the 2030 Agenda for Sustainable Development and the Sustainable Development Goals. I can cite 2 or 3 important SDGs. The SDG 1, which is on no poverty, SDG 2 on zero hunger, and the SDG 10 on reducing inequalities, among others. So implicitly, through the concept of food security, safe and nutritious food for all. So the mandate of FAO is really to ensure that all the human beings have is food secure and having nutritious food on daily basis. FAO has a new strategic framework that was adopted by the member states for 2022 to 2031, which redefined the strategic objective, which will provide the framework for planning future actions. So within the new strategic framework, we are really focusing on what we call the 4 betters: better production, better nutrition, a better environment, and a better life. Because we believe that through the 4 betters, FAO can really support the countries to ensure food security. So to come under the program that you were mentioning, the project that we just launched on the One Health project, which has been launched. So what I would say is that, first of all, the One Health is an approach that recognizes that the health of human beings, of people, is closely connected to the health of animals and also of the plants, of our environment. So we need to learn some lessons for the COVID-19 pandemic, which highlighted the need for preventing the next pandemic using the One Health approach, really to ensure that to have a good understanding of the linkages between the human health, the animal health, and the plant health. So the pandemic affected every sphere of our life, with about trillions of US dollars which lost in economic activities. So such pandemics should be prevented in future by health practitioners working together. So FAO has prioritized One Health at a global level and identified it as priority program area for its new strategic framework 2022-2031. And similar decision has also been made in the different regions, including in the Africa region or also in the Southern Africa. So that is the reason why we launched this program, which is one of the 3 flagship programs that we are launching for this year, for the next few years, and we'll be working very closely with the SADC Secretariat.
Okay. Now you mentioned health professionals. Yeah. So I'd imagine that's only but one ecosystem, because you mentioned myriad ways in which COVID-19 was a major disruption, not only for the survival of human beings, but of states as well. So I'd imagine the fiscus would have to be involved, better budgeting, but that there needs to be better cohesion. So how will you achieve that, particularly in Southern Africa, and how will ordinary citizens, when can they expect to benefit from this project?
So first of all, I think it's important to mention that this program will first benefit to the human beings, to the citizens in the Southern Africa, because we think that the health challenges that require a One Health approach in Southern Africa region will include a heavy burden of disease, which can jump from animals to human, which are known as zoonotic disease. So it is known that 60% of all infectious disease originate from animals, and COVID-19 pandemic probably originated from bat and passed through another unknown animal before infecting the first animals in China. So above health challenges are fueled by a rapid population growth and high demand for food. So this has resulted into clearing of forests or forested land to create room for agricultural land, resulting into human, livestock, and wildlife contact and possible spread of diseases. So the demand for white and red meat by the population is increasing due to the increased urbanization and to meet this demand. So farmers are trading good farming practices with increased use or misuse of antibiotic, which is a key driver for antimicrobial resistance. So in the Southern Africa region, unfortunately, we have very limited capacity for early warning, risk analysis, and rapid responses. So unlike other regions in Africa, the Southern Africa region in the recent years did not benefit from investment targeting capacity in strengthening in surveillance, diagnosis, and control of particularly those dangerous pathogens which can become threats to human beings. So we really need to focus on strengthening the capacities in Southern Africa to be able to quickly predict, detect, and respond to these emerging health threats, which is limited. So the project will start by addressing those above mentioned problems by starting up the activities which will enhance the One Health approach in the SADC member states, and will really make sure that we build the capacities of the communities of the people who will be the main beneficiary of the program. And this will be really implemented in close collaboration with the SADC Secretariat. So as you said, so the main beneficiary and the target for us will really be the citizens of the Southern African countries.
Do you anticipate any challenges in terms of the rollout?
In terms of challenges, let's say that many countries within Southern Africa region will recognize the importance of One Health in addressing those health challenges highlighted above. So in terms of challenges, we need really to institutionalize One Health at country level and even at regional level so that the population can understand, so that the government can understand the importance of this approach. So this is mainly due to the lack of proper multi-sectoral coordination mechanism, which can bring all the many sectors involved in One Health to work together. So the other challenge has been the limited resources and funding in many countries. So the project will begin by addressing some of the challenges as discussed on and then one of the main outcomes of the project that we launch will be to formulate a program that will really support other countries, because as you know, the project that we launch is really limited in terms of funding, but our objective is to work with other partners, including government and financial partners, to mobilize more resources to have a bigger program which could really support all the 16 member countries in Southern Africa. So the challenges are institutional, but also financial institutions, and also how do we really increase and strengthen the knowledge of the population in the One Health approach.